But we've made tremendous progress. I know you're dealing with other nations to help them out because they really they got hit, some of them very badly, and we're talking to them also, and we're making decisions as to whether or not we're allowed to travel. They're allowed to travel. We've been pretty severe in those restrictions, but I guess we did the right thing by being severe, and we're very lucky to have you. I will say that the vice president is over on the Hill. He's just leaving now, and I told him to stay there and finish it up, but we're doing very well in terms of getting the funding we need, the necessary funding. And I asked for X, and they want to give us more than X, and that's okay, as far as I'm concerned in this case, Francis. That's unusual, but that's okay. But
we have been educating healthcare providers really from day one back in January about the need to be on guard against respiratory syndrome. And then when we had this case of the long-term care facility in Washington, we sent out special alerts to long-term care facilities to be very mindful about infection control, isolation with these most vulnerable of our seniors and other individuals who have comorbid conditions. And that's really what we've been seeing around the world is the prevalence of fatalities have been in the elderly and those who have other forms of medical fragility, comorbid conditions. And so really being on very high alert in our nursing home community is called for. For the average American in your daily life, the risk of getting the novel coronavirus is very low. But if you are around individuals who have the novel coronavirus, the risk obviously is higher. And that's why the efforts we're taking with the state of Washington and with Santa Clara County and elsewhere in the country are around what's called community mitigation, which is to isolate individuals who have the disease, as well as to reduce social contact to bring the level of disease spreading down.